Welcome back to The Price of Business. I am your host, Kevin Price, talking to you about you and your business. You know, anyone, I can't talk. I got a speech impediment. Fortunately, I have doctors on the phone, but they're not that kind. We're going to spend a little bit of time talking about something I'm very concerned about, very interested in, which is ADHD. And my friend Frank Granett and I have been working now for quite some time, educating people and working on getting the word out there on the problem of the over-medication of ADHD. And this organization is CAOOY.org. It works together with the Price of Business, creating the Price of ADHD Business. And Frank, as always, glad to have you on the show.
Yeah, great to be on again, Kevin. And, since we began, Kevin, the actual amount of people and even parents, educators, as well as public healthcare policymakers are weighing in and actually voicing their concern. And, today is no exception. We have an expert public healthcare policy experienced person with us today. And she's known for her work at the National Institute of Health Office of Alternative Medicine in Washington, D.C., and she went on to take a look at the role of alternative medicine in our healthcare system. And with her experience of over 25 years now, our guest, Miss Beth Clay, is helping people realize the dangers of over-medicating, especially our young child population. Currently, she's an International Human Rights Commissioner with the Worldwide Citizens Commission for Human Rights. And Beth, great to have you on our program today.
I'm glad to be on your show.
Let me ask you real quickly, because, by the way, I'm a huge believer in alternative medicine. I had a health condition that medical doctors thought might be neuromuscular, might be actually potentially MS, and they explored all kinds of things. And finally I went to a holistic doctor who said, yeah, you've got adrenal fatigue, which the medical community says there's no such thing as adrenal fatigue. Well, guess what? They treated adrenal fatigue, and I probably feel better now than I did in 20 years. And so there is this alternative out there that deals with causes and not with symptoms, merely with symptoms. And it really is transformative. So I say that because, my questions are sympathetic, but I do have questions nonetheless, because I think there's a prejudice, particularly in the medical community, when it comes to the idea of alternative medicines. And I would love to know what your credentials are. What is your background?
Well, my background is I'm a policy wonk. My background is in public policy. I'm not a healthcare professional per se. I don't have that kind of training. I came out of an administrative track and then was recruited to work for a congressional committee. And so I really devoted my life to the public policy end of answering these tough questions. For instance, in looking at the role of integrating complementary therapies into our healthcare system, which we've done a pretty good job because the American public is demanding it, oftentimes out of frustration, but also because of a philosophical perspective of let's try natural first, let's try a different systematic approach to healing, looking at chiropractics and acupuncture or massage as opposed to a prescription drug. Those pathways to healing are as effective and sometimes more effective.
Yeah,
so that's where I come from.
Before I let Frank ask a couple of questions, because I know he's biting at the bit, can you give us a website where people will be able to get more information about you, by the way?
About me, my website is bethclay.com, BETHCLAY.com, and the Citizens Commission website is CCHRINT.org for CCHR International.
All right, I asked a couple of questions. You go right ahead and do the same, Frank.
Okay, yeah, Beth, we talk about the Center for Disease Control, and they released data from their national center and recently about ADHD and what group is most medicated with these types of compounds. And now you're from a public policy standpoint. What do you feel, and why do you feel state Medicaid, and we're looking at Medicaid dollars here, and that problem? Explain to our listeners the policy of Medicaid, first, assessment, go right to drug therapy. Can we look at that, and can we kind of move to a better policy, like a better public health policy that involves the things that we're going to talk about today, the solutions to get to underlying causation.
Certainly. Back in 2002, when I was working for Congress, we actually did a hearing looking at the over-medicating of children who had a label of ADHD. And this came out of a Journal of the American Medical Association study that said we were diagnosing children as young as 1 year of age with attention disorders and then medicating them with drugs like Ritalin. Now, Ritalin is a drug that acts like a slow-release cocaine in the brain, and for a child with a developing brain at the age of 1, absolutely inappropriate to medicate them with this type of drug, and that's what all the experts would tell you. Many people will say you can't even diagnose ADHD before age 8. So here we have, in this population, 50% higher likelihood of being diagnosed and medicated if you're on Medicaid, if you're getting medical assistance from the government. So Medicaid is a joint partnership between the states and the federal government, and this is the biggest population of children who are being drugged. They're not getting what is considered the best approach to care, which is therapy first, drugs second. Instead, it's going straight to these very strong psychiatric medications at an increasingly young age, and that is frightening that we're taking children who are in socially disadvantaged areas already, potentially not getting a good diet, and we're throwing psych meds at them in their developing brain. So that's a recipe for disaster for them growing up.
Yeah. And another question, Frank.
Okay, and let me follow up, Beth, on this now. Okay, with your experience in public policy making, if you will, you got 25 years in the business, right? So let's look at how we can let our listeners know, and then we can, autism, this doesn't even touch autism yet because we already know autism is far, even just as big an epidemic as ADHD with our young children population. So how do we get, or what do we have to do? What's a quick 1, 2, 3? What's the first implementation?
The first thing is to get back to basics.
Government together.
Let's restore physical activity to education. Right now, children do not get 30 minutes every day in the school. Second, let's restore nutrition and nutritional education into the education system. Children are being fed processed foods, even when they're on getting their free breakfast and lunch from school. They're not getting real, vegetables and fruits. They're getting the processed frozen foods that don't provide the nutrition they need for their bodies to function. We need to look at those two basics, exercise and diet, as a first line of helping children be as well as they can, and that affects any condition, but in particular behavior. And then we have to look at how do we change public policy. If we're going to give drugs out through Medicaid, we need to require them to also get counseling. We cannot throw these meds at kids and not give them the tools to function in society, and that's what counseling does. Helps them understand the anxiety they may feel, how to manage their stress, what to do to be able to sit down and focus in class. We have to give them the tools in the toolbox rather than just throwing meds at them to control their behavior.
I'm fixing to have to wrap it up with that. What a great conversation. I'm assuming, Frank, you're going to provide an article that will accompany this for USDataReview.com. That site gets about 1 million hits a month. I'd love to talk to you more, Beth, because fascinating background. What I found really interesting, by the way, I'm an old friend of Dan Burton. I used to work for Senator Gordon Humphrey back in the 1980s, and so I had a lot of friends in the House, and I knew Congressman Burton. I saw that you worked with him, and I noticed you're a small government advocate when it comes to these type of issues. That's very rare, and I think though that, for example, if you look at Food Inc., the movie Food Inc., how you could think government is a solution to things like food, you're nuts, because part of the problem is massive corporate subsidies, crony capitalism that has led to the subsidizing of food that is destroying human beings. And it's all being done because of big government. And so I love your message, and I appreciate both of you today.
I'm happy to talk to you anytime. I look forward to it.
It was a great segment. By the way, you'll be able to see this segment plus great additional content by Frank Granett over at USDailyReview.com. More for you after this on The Price of Business.